Hi, my name is Savanna. I'm one of the respiratory therapists here at Temiskaming Hospital. This year at the Radiothon, we will be fundraising for a pediatric infant ventilator for our emergency department. So we're going to go through a few visuals of how this Monal 260 ventilator works and show you a little bit about the infant and pediatric capabilities. This is the piece of equipment that we have now. This was purchased in 2008, but we're hoping to replace it with something that is a little bit newer. So this ventilator here, it has the capabilities to do infant, so anything greater than 3 kilograms, all the way to pediatrics and adult. What that's based off of is volume. So a tiny baby requires less volume than a large adult. So for example, I may only need 350 milliliters of volume, but a little baby needs maybe 20 milliliters. That's dependent on the ventilator being capable of doing that and the circuit size. So this is the tiniest circuit that you can get for a tiny lung. You can see it's ventilating here. And this ventilator, the old one, we don't have these capabilities right now to do with a infant. We have the 3 different circuit sizes. So this is the pediatric 70 and 100 milliliters. Loud and very obnoxious. So this one is portable. It's just a lot heavier. It's a lot more cumbersome, whereas this one, you literally just take it off of the stand and it has a bag to come with it. Just goes over your shoulder and you'll need the oxygen tank and you can go for a transfer. So it's just adding something more updated and for all patient populations for our community. Ventilation modes, so invasive volume or pressure, and a spontaneous mode. You have these modes here too. And then you just go to the mode you want and you validate. And then it'll start ventilating. Switch the circuit back to this side. This one should fit. So this is the adult lung that will show ventilating. So it has capabilities of the infant, pediatric, and adults. So all we do is we hit the adult function, and then you would pick the appropriate ventilation mode that you want and whatever parameters you need. And then when you're ready, you just play. So it has the capabilities of all of the patients, and it knows as soon as you hit the infant, pediatric, or the adult, it knows that it's going to be using the circuit that is appropriate. It takes into consider all the dead space and whatever else that would be impacting the safety of the ventilation. So you can see the volume of an adult is a lot larger. So this test lung is a 1 liter test lung, whereas this tiny infant test lung is maybe 15 mil. That's why it's important for us to have an appropriate ventilator for little people that are coming into our emergency department.